Imagine going to the pharmacy just to find out your Part D drug coverage had been terminated over a $7 bill. Well, that happened to several of my clients this year, and unfortunately, I'm afraid it happened to thousands of others in 2026. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys a true story of how several of my clients had their Part D drug benefit terminated over a bill they didn't even know existed. And I'm gonna go over three real basic topics. Number one, I'm gonna give you a backstory and tell you why I think this is happening. Number two, I'm gonna tell you why us brokers don't have the oversight that we used to on these Part D plans. And then thirdly, I'm gonna tell you what you can do to make sure your benefits don't lapse, and that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you're finding this content helpful. I really appreciate you doing that. Okay, for starters, when you have a Part D drug plan, you can opt to have that premium come directly out of your Social Security check. Now, oftentimes, Part D drug plans have small premiums. And in the last few years, including 2026, there has been Part D options for $0 per month. So imagine in 2024, you were on a Part D drug plan that cost $7 per month. Now, when you made that selection over 2 years ago, you were able to select Social Security billing, which meant that that $7 just came right out of your Social Security check. Because that's such a small monthly premium, people usually didn't realize it, and they just thought that whatever Social Security amount they were receiving was their total amount. Okay, now the following year in 2025, that insurer, let's pretend they changed it from $7 to $0 per month. So now you have a plan that has no monthly premium. You are obtaining that drug coverage for no monthly cost. But now in 2026, that same plan, let's say they added back a monthly premium of even $5, $6, or $7. Well, what happens is that person can no longer have that payment come directly out of their Social Security check. They would have to opt back in to that process. This is exactly what happened to so many people. They had a Part D drug plan that had no monthly cost, or the cost was coming out of their Social Security check. Once the company decided to start charging a monthly premium again, they had no way to collect even that small amount out of the person's Social Security check without them re-opting into the Social Security billing. So because they couldn't take the premium out of their Social Security benefit, instead, they mailed a bill directly to the beneficiary. And what happened was thousands of people ignored these small bills. With all the amount of mail you get from Medicare and advertisements and just plain solicitations, so many people never saw this $7 or $8 bill that ended up coming in the mail. Now, the Part D plan has to give you a 60-day grace period for payment. And from what I experienced, that grace period started after the first month was unpaid. So if the beneficiary went all of January and didn't pay the premium, that's when their grace period started, which meant they had 2 more months. They had February and March to make up those payments. And then they went to get their prescription filled in April, only for the pharmacist to tell them, hey, your Part D drug coverage has been terminated. You don't have coverage. So you went all of January, February, and March thinking there was no monthly cost, when in reality you were getting a bill in the mail for somewhere between $7 to $10 per month. So by the time you went in April and filled your prescriptions and realized you had no coverage, it was too late to go back and do anything about it. But there's also another issue happening behind the scenes that most people have no idea about. Which brings me to my second point, which is why brokers oftentimes cannot see these billing problems anymore. So to set the table, you need to understand that over the past few years, 2023, 24, 25, a lot of the companies that offer Part D drug plans, they have moved the broker out of the process. So whatever their reasoning was, they won't offer that Part D drug plan through a broker like myself. As a broker, we're faced with two choices. A, we could tell the client, hey, you got to go figure this out on your own. Or B, hey, we will do this all for you, but we're going to do it through your Medicare.gov account. And that's mostly the way things have worked for the last 2 years. If we want to help enroll somebody in a Part D drug plan, we have to do it through their Medicare.gov account. Meaning, when I help somebody with a Part D drug plan, I'm doing it as a favor. You see, we don't actually enroll the person through the insurance company. We do it right on Medicare.gov, which means we have no oversight on the back end. So we price the prescriptions for the client, we tell them what pharmacy to go to and what drug plan is going to be best for them. We even help them do the enrollment. But once we hit submit, we are out of the picture 100%. That means that we never got compensated to sell you that plan, but it also means we have no oversight. We can't tell if your application was approved, we can't tell if you're having a billing problem, or if you're delinquent on your payment. So all the communications you're getting is directly between the consumer and the insurance company. And I think a lot of the times, our clients or Medicare beneficiaries will think that we have oversight and we can see all those things. In other words, they're thinking, Larry, why didn't you tell me my plan was overdue? And the answer to that is because we had no idea. We enrolled you through Medicare.gov as a favor to make sure you had drug coverage. But once we hit that button, we have zero oversight on what happens the rest of the year with your drug plan. So how can you protect yourself from this happening to you? Well, number one, I know you get tons of junk mail about Medicare, but if it is from a company that you already do business with, make sure you open that mail. Number two is don't assume things are the same from year to year. Part D drug plans are 1-year contracts. So if they charge $0 a month this year, that does not mean that's what's going to happen next year. You should always verify that a premium was taken at the beginning of the year. So when January rolls around, make sure you know where your Part D drug premium comes from, where your Part B Medicare premium comes from, and then where your supplement premium comes from. And make sure you see that hit your bank account or your credit card sometime in January. And finally, and most importantly, make sure you review your drug coverage each year with your trusted Medicare advisor or broker. Even if you have no prescription drugs, your plan can still change in price. So even if it's a 1-minute phone call, it's important get with your broker every year to find out what's going to happen to your plan on January 1st. So the big takeaway here is the Part D drug system has changed a lot over the past few years. Brokers have less oversight than ever on your Part D drug benefit. Some plans that used to charge $0 a month are now charging a monthly premium. Make sure whatever you do that you know what your monthly cost is when the year starts so you don't get stuck without coverage. And if you want a better understanding of how Medicare works long term, including whether or not you can get stuck in a Medicare Advantage plan, I would watch my next video that hits on that topic exactly. Thank you guys so much for watching. Larry Goist, LMS Insurance Group.